going to go to this lady first, and then
Take care of it.
I'm going to go to this lady first.
My question has to do with private health care insurance company profits. Since 1999, employer-based health insurance premiums have increased 120%. That's the premium your employer is paying. It just went up another 5% in 2008. My question is, how long do you think you're going to have that insurance if it keeps rising like that? And what is the incentive for private insurance to keep their costs down? There is no incentive for them
And
to.
what system would you put in place?
I want Medicare. My COBRA is running out in 3 months. I'm unemployed. I have no chance of getting a private health care policy because I've tried and I've been rejected. My daughter.
Ooh, there.
I can get you one. I've been in the business 15
How much
years.
money is it going to
Okay,
cost?
wait, let's go.
How
Wait.
much money is it going to cost?
I don't know how.
I'm 50 years old. So, goodbye.
I would like to know, I sincerely like to know what your plan is. Would you like to be on Medicare?
I would like to be on Medicare.
And at what age would you like for Medicare people to be able to
I'll
buy
tell you
Medicare?
what age should be. Everybody who's over 45, your premiums increase hundreds of dollars more than people under 45. So I think 45 would be a good place
And
to start.
how would you price the premium?
The same price that people who are 65 pay.
So would you expand the entire Medicare
Yes.
system to age 45?
Absolutely.
Who's going to pay for it?
Is that not a problem? Is that a problem?
Who's gonna pay for it?
You know what?
Who's gonna pay for it?
I'm willing to pay premiums for that. Okay?
Premium.
I'm willing to pay it because private insurance.
Okay, wait a minute. Now, wait. You're in the office. Okay.
They have to have a profit.
No, you're part of the audience.
Okay.
Okay? And you've asked me a question. You've given me an honest answer about that. You would lower the age to 45 and have anybody that wants to, would you opt in to Medicare and then
Absolutely.
pay a premium?
Yeah, if you get rejected by all these private insurers, which I'm sure I will be, and I guess my option is the Texas high risk pool.
No, I mean, the bill could be written to provide that.
That would be great.
But the bill is being written to provide up 50 million people with health care. If you concentrate,
So how do I
wait,
qualify?
if you let me answer, if you would concentrate, the bill could be rewritten to concentrate solely on this lady here,
Thank you, I need some.
this lady here, and this lady, and you,
Yeah, I'll take it.
to where if you could not acquire health care, you would go to a pool in the state, not the high-risk pool that would be formed out of this bill, and those 15 million people in America could be served. And this bill could cost 100 billion, 200. It could be paid for easily out of the budget, and you could have that.
Well, let me ask you this, how about a sliding scale?
It's not been proposed. It's not proposing.
The gentlewoman says her time.
What about the man? Okay. Yes, sir.
Until recently, I was actually paying $1,200 a month for COBRA insurance, so I'm blessed I got back into a situation where my company would co-share that. But part of my view is part of that escalating cost that we're all paying for, whether it be from the premiums for Medicare, the premiums for traditional health care, is in part due to, as you said earlier, a lot of things are going on that we don't have visibility to. We can't really track. We have people flying from Germany or South Africa on the last breath coming to our country and then getting, treated here for free, and you and I are paying for it, which means the hospitals raise their premiums or their costs because a lot of people who aren't paying. And then we have people coming in from other countries that are having babies here, and we're paying for that as well. So part of it is, yes, we've got to find a way to fix the holes in the ship if we want to curb the upward spiral. Have some as you said here with other folks, that give them maybe an opt-in option where they can opt into a plan where maybe they don't have the traditional corporate co-sponsored plans. So I'd like to just kind of consider that, but there's really a big giant hole in the ship. Thank you.
If we would focus this bill on the working poor, the uninsurable, those that cannot obtain insurance, and those that do not have proper access to insurance, this bill would address about 15 million people in this country. We could do it effectively, we could provide this access that we're talking about, and we could provide, I believe, affordable premiums that on a sliding scale, the government would participate in. And the problem is we're trying to pay for 45 or 50 million people when we ought to be focusing on this smaller group first. And then once that group's taken care of, then we can go on to the group which is the healthiest group, and it's those 18 to 30-year-old bulletproof kids that don't believe that they need any insurance, and they could buy insurance the cheapest of anybody in this room, but they won't buy it. Then we could move on to the 14 million people that qualify for Medicaid, qualify for Medicare, but just go to the emergency room because it's the easiest thing to do and they won't sign up for the programs. The next group of people is 10 million people that are legal immigrants with green cards but not citizens. And then the last group is the 10 to 14 million people that are illegals. Now, none of the plans, even Obama's plan, Baucus's plan, nobody's plan, pays for those 14 million people.
There's nothing that excludes
And what we're for, sir, the Republicans are for sitting down and coming up with a plan that addresses those 15 million people first. This lady back here, this lady down here. And you can't do that if you're trying to draw a plan that takes care of 40 million people. So we could have a sliding scale. We could have a pool. We could have access to uninsured. It would not cost $1 trillion. And it would make America better. Yes, ma'am.
First of all, I've never been political in anything. I'm just...
I've always been political in everything.
Well, that's your job. I truly respect that. But me, myself, I've never been in the political arena, ever. And this truly, truly upsets me. For number one, we're all missing a point. We can't afford it. I can't have anybody taking any more money from me. There's no way, whether I'm on this side or that side or your side or any side. I don't have it. I don't have it. I don't care if you're for a Democrat. I don't care anymore. What I care about, sir, is the fact that I can't afford it, and I'm going to leave this complete mess to my children and my grandchildren, no matter what side you're on. No matter what side you're on, it doesn't matter. In the end, it doesn't matter if you're
So
Republican or
what's the
Democrat.
next step that
The
you...
next step is there is a way for her to be covered and for her to be covered. If they could sit down, for number one, it disturbs me that nobody in the government wants it. So that means itself that there is a big difference or something wrong with it. They won't take it. They don't want it, they're not using it. Is that not correct? Did you just
There are
say-
14 million people that, and children that qualify for Medicare or
No, I'm
Medicaid.
talking about you, the congressmen and the senators. They're not taking this bill. There's got to be
If you
something
don't
wrong
want it,
with
why should we?
Well, I'm perfectly willing to live under this
I
bill.
know, you may be perfectly willing, but there's something wrong with it if the majority of them do not want it.
Well, I think that you're going to find that there's a very small minority of the congressmen and senators and government employees. I mean, it's what the job comes with. If the government says this is the insurance policy, you want the job or not? And you say, okay, I either want the job and I'll take the insurance policy, or don't want the job.